Hello, guys. My name is Yasmin Lisdo.
My name is Nick Harris.
And I'm Emily Rausenberger. We're going to do our presentation on punishment. So punishment refers to consequences that immediately follow a behavior, which decrease the probability of that behavior occurring in the future. So either the addition or removal of a stimulus to decrease the probability of an inappropriate behavior occurring again. And the two types of punishment are positive punishment, or type 1 punishment, and negative punishment, or type 2 punishment. According to the Cooper, Heron, and Heward book, Applied Behavior Analysis, there are 4 factors that may influence the effectiveness of punishment procedures. So some of these factors are immediacy. So the onset of the punisher occurs as soon as possible after the occurrence of the target behavior. The longer the time delay between the occurrence of the response and the occurrence of the punisher, the less effective the punishment procedure will be in changing the target response. The next factor is intensity or magnitude. So the greater the intensity of the punishing stimulus, the more immediately and thoroughly it suppresses the occurrence of the behavior. So while punishing the stimulus needs to be intense enough for an effective application, it should never be more intense than necessary. The next factor is schedule. The effects of a punisher are increased by a continuous schedule of punishment in which each occurrence of the behavior is followed by the punishing consequence using a fixed ratio. So the greater the proportion of responses that are followed by the punisher, the greater the response reduction will be. And the last factor is reinforcement for alternate behaviors. So research has shown that punishment procedures are most effective in reducing inappropriate behaviors when reinforcement is provided to alternative behaviors. Next, Jay is going to discuss positive punishment.
What I'm going to talk about now is when should punishment be used, and I'll go in a little bit more about detail in that. Punishment can be misused and should always be overseen by a certified behavior analyst. At times, it can be an important component of a treatment package. Punishment can be used in a therapeutic manner. Not using punishment withholds a potentially effective treatment and may place the client in danger, especially in situations where other procedures have been tried without success. When punishment is used, alternative behavior should be effectively taught using reinforcement. Also, when using punishment with the client or the person who makes the decision for the client, such as punishment is used to with the client or the person who makes decisions for a client, such as parent or the guardian, who must give informed consent. Within the informed consent document, all the potential benefits and risk of using punishment should be outlined. Also, the teams should reach consensus that the benefits of punishment outweigh the risks. If so, a plan can be developed based on a functional behavior assessment to decrease episodes of target behavior. And that's a little bit about that. Emily is going to talk more about negative punishment.
Okay, so when the removal of a stimuli, such as the removal of a reinforcer for a specific behavior, acts to decrease the behavior, the effect is referred to as negative punishment or type 2 punishment. I'll talk about some tactics that are used in association with negative punishment. The first tactic is timeout procedures. The child is removed from a preferred environment or activity. So there are a few different types of timeout procedures used. The first type of timeout procedure is called non-exclusionary timeout. This is when the child is removed from the activity but stays in the room. The next type of timeout procedure is exclusionary timeout. That is when the child is removed from the room where the preferred activity is. And the last type of timeout is called a CO chair, or a contingent observation chair. This is when a desired behavior occurs. The child will sit in a predetermined chair and observes observes the rest of the students or classmates engage in the child's most preferred activities. So if a child loves to play Candy Crush on the iPad and the behavior we're looking at is hitting, if they hit somebody, they're going to go sit in the chair and the rest of the kids will play Candy Crush on the iPad. The next tactic I'll talk about is response cost. The removal of a specified amount of a reinforcer contingent on the occurrence of a problem behavior. Token systems are a form of response cost. So a token system is used to reinforce appropriate behavior, and tokens can be removed once an inappropriate behavior occurs. The last tactic I'll discuss is called planned ignoring. Planned ignoring occurs when social reinforcers such as attention or physical contact or verbal interactions are removed for a brief period, contingent on the occurrence of an inappropriate behavior. So if a student is calling out, the teacher might remove eye contact from that child until they're appropriately raising their hand or whatever they're supposed to be doing. So the BACB, Professional Ethical Compliance Code for Behavior Analysts, section 4.08, talks a little bit about considerations regarding punishment procedures. I just thought that a few of them were important to bring up. So before implementing punishment-based procedures, behavior analysts should ensure that appropriate steps have been taken to implement reinforcement-based procedures. I think Jay talked about this a little bit before. And another one is that behavior analysts should ensure that an increased level of training and supervision and oversight accompanies aversive procedures. And that behavior analysts should evaluate the effectiveness of aversive procedures in a timely manner and modify as needed. So now Nick is going to talk to you guys.
All right. So again, my name's Nick, and my portion of the presentation is going to focus on research and culture, including ethics related to the research and culture as they relate to the use of punishment. So the first thing that I want to talk about is something that we call assent. Assent is not the same thing as informed consent, which Jay had covered a little bit. Assent, it's a term used to express the willingness of a participant in the research, testing, or interventions or treatments that we use. It doesn't, by definition, these are individuals that are too young to give informed consent, but they're old enough to understand the research, the testing, the interventions, and the work we're going to be doing with them. And again, as it says there, assent does not replace informed consent. An example of assent would be testing a student or doing an intervention, and you ask them, you know, is it okay to work with them? Will they answer some questions? Do they willingly complete tasks that you've asked them to complete? If so, then assent is considered to have been received. Now, people may be asking, what does this have to do with punishment procedures? So just hold on to that thought, and I'll get there in just a second. So the first question is assent required? Yes, it is, but again, it doesn't replace informed consent. So let's think about this. If the children we're working with aren't willing to answer any of the questions or to complete the tasks that we're asking of them, then how can we do what we do? Testing, interventions, behavioral therapy, it couldn't happen. Therefore, it's required, but not legally mandated. So the next question is, how is assent relevant to punishment? This has to do with evidence-based interventions. We're supposed to be using procedures that are evidence-based. So there's research out there showing that their effectiveness. Usually we look at what's maintaining a behavior and we implement some type of intervention to reduce problematic behavior and increase pro-social behavior. Well, a lot of this research comes through universities and institutions, and they require not only informed consent from a child participant's legal guardian, but they also require documented informed assent from the participating children. So now that we've got that out of the way, what does the research say about punishment procedures? There's a lot of punishment procedures out there that are used. So in the interest of time and narrowing it down, the one that I focused on right now is timeout. And I did that because schools, clinics, homes, even hospitals, timeout is one of the most used punishment procedures. You know, in 1973, Clark, Roberry, Bear, and Bear did some research looking at timeout and whether or not it's an effective punishment procedure for individuals' disruptive or aggressive behavior. And what they found back in 1973 is that it is an evidence-based procedure, and they also found that intermittent punishment procedures may be nearly as effective as continuous punishment procedures. So kind of almost like the fear of the punishment procedure happening reduced the behaviors as much as if every time the behavior was engaged, punishment was introduced. That research is a little dated, so looking back, trying to get more updated research, looking at the results from Everett et al., they also looked at timeout procedures, and they found that timeout procedures have been proved as an effective method of reducing or eliminating escape-maintained non-compliance behaviors. And that gets a little bit tricky because timeout removes you from a situation, and if the behavior is maintained by escape, how does it eliminate the behaviors? In their research, they talked about, you know, you have to be very careful in how you define the behavior and how you set up the behavior plan, and it takes a meticulous detail in having it implemented. And then in 2010, Rodriguez, Thompson, and Bainum concluded timeout is an effective punishment procedure when non-compliance behaviors are being maintained by attention. So we think about in schools or in clinics, when children are playing with their friends, doing different types of things, even if their behavior is non-compliance or getting attention from peers, you remove them from the situation, they're no longer getting the attention from their peers. So the non-compliance behaviors decreased because they were removed from the situation. The next important thing to talk about outside of evidence-based for research in terms of the use of punishment procedures are the cultural components. Culture is so important to what we do. So first, culture is considered to be, is defined as an organized set of thoughts, beliefs, and norms used for interaction and communication between individuals or groups of individuals. And this may influence individual or groups' cognitions, behaviors, or perceptions. This is defined by Nugent and Klotz in 2004. What this comes down to is treatment acceptability, which is the extent to which a change agent reports finding a treatment palatable. What influences, there are 5 primary factors considered to influence treatment acceptability, and they are problem severity, treatment approach, time needed to implement the treatment, and side effects of the treatment. Treatment acceptability can be determined by a culture because different cultures have different perceptions on what is problematic behavior, what punishments are too aversive, which ones aren't punishing enough, are they expensive, do they actually work, what are the side effects. So some examples of the importance of culture when it comes to punishment procedures in the evidence base is that, you know, some treatment and intervention procedures involving physical restraints like CPI, PCMA, delivered to a male by a female, or vice versa, delivered to a female by a male, may be viewed differently depending on one's culture. Jewish, Muslim, Hmong, Native American, even Caucasian Americans may view whether or not it's appropriate for a male to restrain a female or a female to restrain a male. Corporal punishment's another big one. It's been in the news a lot lately. So corporal punishment procedures may be viewed differently depending on one's culture. You know, Caucasian, African American, Hispanic, Somalian cultures may view what may define corporal punishment differently, and may see it either as completely unacceptable, a range of acceptability, or always acceptable depending on their upbringing and their culture. And lastly, because I had talked about timeout research, punishment procedures based on shaming may be viewed differently depending on one's culture. And I say that because some cultures actually consider timeout to be shaming. You know, some Asian, Hmong, Asian American, African American, Hispanic, different cultures have different interpretations, And some cultures feel that removing a child from an environment where they're having fun and watching others participate in what they're not allowed to brings shame to them. So through the research, looking at culture, punishment procedures, things like that, all of the researchers from 1970 until 2010, and even in some of the textbooks that we've read for this class and some of the other classes in the program, they all demonstrate there's strong empirical evidence for the use of punishment procedures when appropriate, but they offer the following advice or guidelines. Always make sure you know what is maintaining the behavior. We want to do that with everything, but it's very important with punishment procedures as well. Before you use punishment procedures, make sure you've exhausted all other less aversive options. So don't jump straight to timeout. Try doing something else based on reinforcement. Make sure you'll not be harming the clients. So timeout is one way you could use punishment that wouldn't harm the clients, but another way could actually be considered physical abuse in some forms of corporal punishment. Make sure you're considering cultural factors or variables that may impact the acceptability of treatment. So this is important and why we work with families in choosing procedures based on their cultural needs. And then lastly, make sure you're following all pertinent laws and ethics. So next, here are a list of some of the ethics from the BACB guidelines that have been identified that kind of match specifically with what we've been talking about as far as culture, research, ethics, and the different types of punishment procedures. All of the different guidelines presented in the BACB would be pertinent, but these ones kind of hit it right on the head, specifically assessing behavior, know what function it is, know what's being maintained, using reinforcement before punishment, but if you're going to use a punishment procedure, make sure that reinforcement's being used as well, being familiar with the guidelines, and being aware of the research out there. Next, what I'm going to do is show a video of corporal punishment in the schools. This kind of brings the research together, the cultural together, the ethics piece together. While watching the video, it might be a good idea to think about, is this ethical? Is it legal? Is there a difference? It could lead to a good discussion point. 1 second. It's not showing. Here we go. So in that video, it was a classroom in Asia, not really sure where. But let's think about what we saw. Is it ethical? Is it legal? And is there a difference? I know my first immediate reaction was, how is this allowed? But upon further investigation, I actually found out that in some states in America, the use of corporal punishment is actually still allowed in schools. It's up to individual school boards to determine if it's going to be used. Indiana happens to be one of those states. So this might be one of those situations where if a school board were to approve it, it may actually be legal to use, but if we were working in that school system and that was what was being used in the school system as a punishment procedure, it would be our responsibility, according to our ethics code, to step in and say, no, we shouldn't be doing this because we're supposed to prevent harm to our clients. Another example of a situation where ethics could come into it is, let's say hypothetically you're a BCBA and you've been brought into work in a school and a student diagnosed with ASD. No interventions have been used to this point. After collecting your data and conducting an FBA, you determine the non-compliance behavior is maintained by attention, specifically social attention. You recommend a timeout procedure as part of the BIP. Is this ethical? Well, even though we've presented you with information suggesting timeout is an effective punishment procedure, it's not ethical to go right to a punishment procedure when no other options have been tried, especially one that doesn't also have part of a reinforcing procedure involved with it. We need to make sure we're exhausting all other options and using the least restrictive options prior to the use of punishment. Specifically addressed in this scenario are BACB guidelines, 4.05, 4.10, and 7.03. Suggested next steps would be to research evidence-based practices that focus on reinforcement and not punishment and are least restrictive in helping to reduce the students' non-compliant behavior. The next thing I'm going to show is the list of resources that the three of us used for each of our respective components of our presentation. All right, that's all that I have.
All right. Thanks, everyone.